Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great exercise for those of you suffering with spondylolisthesis of the lower back. We have a wonderful exercise known as the Multifidus recruitment exercise associated with the hip hinge. It'll help you resolve pain, strengthen your back, and stabilize your spondylolisthesis. Hope you enjoy it. So this is a great exercise for spondylolisthesis because it's going to train a stabilizing muscle of the lower back called the multifidus. The multifidus is a small muscle that runs from the center of the bones in our back down and out to the sides. And that muscle has a unique function of taking the capsule of the joint. The facet joint is where the two vertebrae connect, and there's a ligament that surrounds that joint. And many times in spondylolisthesis, whether it's an anterolisthesis where your vertebra has slipped forward, or even a retrolisthesis where your vertebra has slipped backwards, that joint capsule gets pinched. The inside lining gets pinched between the joint, between one vertebra and the next. And that creates something called a synovitis or an entrapment synovitis and a lot of pain. A lot of spondylolisthesis pain is associated with extension, leaning backwards, or coming up out of a chair, or coming up out of a squatted or stoop position, and that's because the spine is bending backwards, overarching its curve, and many times that capsule gets trapped underneath. But the multifidus, some of its fibers attach to that capsule, and it's uniquely qualified to actually pull that capsule backwards and avoid that pinch. So that's the muscle we're going to target today with the exercise. So we're going to engage a couple muscles first. Remember, if your setup for this exercise isn't correct, then you're many times going to be strengthening the dysfunctional biomechanics of your body, and that's only going to lead to more pain. So pay attention to the correct setup for your unique body. Remember, the best exercise for you is tailored specifically to your unique body and biomechanics, not general tear sheet exercises, which many times only strengthen dysfunction and lead to more pain. So we're going to engage our multifidus by grabbing the back vertebra knobs. Pick any knob you want in your lower back, and move your fingers down to the bottom of one of the knobs, and use one finger on the left bottom corner and the other finger on the right bottom corner. As you draw your lower abdomen inwards towards your spine, normally you're going to feel a bulging outwards into each finger, and that's the multifidus muscle contracting. If you feel one side bulging more than another, then focus on that lower abdominal pressure coming in and headed towards that side where you don't feel the bulging out as much. Many times that'll wake up an atrophied, weak, or inhibited or delayed multifidus muscle. We're going to make sure our alignment is correct. If you have a tendency to lean to one side or twist to one side with either your hips or your pelvis, you want to make sure your alignment is set. If you're not sure what your alignment issues are, go to the Pain Free and Fit or Posture Size websites. We have a free body analysis that'll teach you what your alignment issues are. So basically, we want a square body structure with no alignment issues of the hip or the ribs. We want the lower abdomen, which engages the transverse abdominis muscle. That wraps around and attaches to much of the fascia that supports and helps to stabilize that spondylolisthesis vertebra. And we want that multifidi engaged by feeling that bulging out. And then all we're going to do is we're going to bend forward from our hip joint, from the ball and socket, an inch or two, and hold that. We're going to start with that hold for about 5 seconds, and then slowly squeeze the buttocks to come back up again. If you notice, as I'm going forward, my head through my tailbone is pivoting forward on the ball and socket of my hip joint. I'm not leaning forward from my waist. That would create tension and movement in my back, which fails to keep it stable. So all the motion is in where your leg and your hip bone or ball and socket attach. As I hold that core and multifidus contraction, I'm simply coming forward an inch or two, holding that, and then squeezing the buttock to come up. This trains you to come up with that multifidus, pulling the joint capsule out of the joints. You're making sure you have a little tail under tension. You notice when I did that, I kept my tail slightly under, or pubic bone up. That prevents the multifidus and other back muscles from overarching the back and extending and irritating the spondylolisthesis area. And as I keep that tail under to a comfortable degree, that core muscle engagement and my alignment, I'm simply coming forward from the ball and socket, pausing for 5 seconds. Eventually you can build up your time to 3 minutes, and squeezing the buttocks to come up, training the body to extend or lean backwards the correct way, using hip motion and not back motion. That keeps our low back stable. You can use this to increase repetitions and to increase time that you're bent forward before you come up. You can do that every other day, taking a day rest in between workouts so you don't overtrain yourself. If you like this exercise, we have plenty more. I invite you to subscribe to our channel or to leave a comment if you have any questions or any ideas for future videos. Hope you enjoy this exercise to help your spondylolisthesis.